Good afternoon, everyone. Welcome to the latest PHA Roundtable. Today, I'm joined by some wonderful people we'll introduce shortly, but today's topic is about our topic of the month, which is chronic disease. And we want to have a basic understanding of what is chronic disease. And very importantly, let's lead it down the road of what can we do to prevent chronic disease? What can we do to take responsibility for our own health to prevent these issues arising? So if I could start, I'll go around the room. Just everyone quickly introduce yourself for a minute. That'd be fantastic. Patrick, if you could kindly kick us off.
Yes, I'm Patrick Holford, founder of the Institute for Optimum Nutrition. I run a charity called Food for the Brain. I believe there are only two fundamental causes of disease, including chronic disease, which is ignorance and addiction. So we can talk about what are we ignorant of that is driving diseases. And also the chronic diseases are really the 21st century invented diseases that have come about from largely the same things happening to our diet and lifestyle. They're, if you like, a progression of the same thing, but hitting different organs, whether it's heart disease hitting your heart, whether it's diabetes hitting your blood sugar, whether it's arthritis, which is a metabolic disease hitting your joints, and ultimately, depression, and then ultimately dementia, Alzheimer's. I think they're all driven by the same things.
Thank you. Wonderful, Patrick. Janet, hello. Would you like to introduce yourself?
Hi, I'm Janet Wrathall. I'm a naturopathic doctor. I've been in clinical practice for the last 22 years. And so I do naturopathy and homeopathy, something called causative homeopathy, nutrition. Patrick, you're one of my heroes, actually. So is Sarah. I do quantum medicine. And so, so I've been looking at chronic disease for 22 years, because I've had that myself. I've had cancer and all sorts of things going on, really, trauma, PTSD. And so I've been using myself as a guinea pig for the last 23 years, as a lot of us do, don't we? And so, I feel that a lot of it does, obviously, I totally agree with what Patrick's saying, from trauma and, lifestyle, a lot of obviously what's going on at the minute with 5G and obviously the vaccinations, in inverted commas, is causing tremendous strains on most of the population. So, I think, we've got to look at lifestyle and nutrition first, haven't we? And then get into the medical aspects and start with the basics, cleansing with the GI tract, kidneys, liver, making sure the emotional trauma is cleared and so on. So, that's how I operate.
Thank you. Thank you, Janet. Hello, Carol. Would you like to introduce yourself?
Yes, I am Carol Boyce, probably the only one in the room who's not a doctor, I think. I've been a homeopath for 40 years. It is my life. I've used it exclusively throughout enormous amounts of shockingly serious diseases, because I've done a lot of work with homeopathy on the front line in places like India and Africa, etc. I'm co-founder of Homeopathy International. I make documentaries about homeopathy. I write stuff about it. It's all I do, 100%. And of course, most of it isn't paid. So that's the other side of my life. I don't know if we as homeopaths I wasn't expecting everybody to jump into the chronic disease bit. So are we going to talk about what it is afterwards? In which case I'll leave my bit. Or
we'll come to that in a minute. I think, we'll do the introductions, and then I think I'll ask the question, what do you see as chronic disease? And give each everyone a minute or two to just look at that, because it's nice to have the different angles. And then we can start looking at how we can address this and prevent it moving forward.
So on the end of that, I teach a lot. I'm, examiners. I work with Middlesex Uni on the only remaining BSc program in homeopathy. Etc. I mean, you get the idea of who I am.
Fantastic. Very experienced, Carol, for sure. That's wonderful. And Sarah, thank you for joining us. If you'd like to introduce yourself.
Now, my name's Dr. Sarah Myhill. I qualified in medicine in 1981. I worked as an NHS GP for 20 years. And since about 2000, I have been working in independent medical practice, specialising in naturopathic medicine. I entirely concur with Patrick. Disease is all about addiction and ignorance. It's all about asking the question, why? If you know why somebody is sick, then you can fix it through natural medicine.
Fantastic. Wonderful. So Patrick, I'm going to open the floor up to you first and just ask everyone, just take 1 minute or 2 minutes to explain in your own words, what is chronic disease? Because we want the public to understand what we're talking about here.
Well, it's sort of things that creep up on you. And what's terribly important is very often we blame the last straw that breaks the camel's back, where really behind all these chronic diseases, talking here about, you start to get little joint aches, and then eventually it's arthritis, or you're getting energy dips and sugar cravings, and eventually ends up as diabetes, or you have sort of gradually increasing blood pressure, and it ends up as heart disease, or your mood and your mind is not very good. You talk about brain fog and feeling low, and it ends up with a diagnosis of depression or ultimately dementia. So things that creep up on you. And we tend to often, blame the last straw that breaks the camel's back, like it was the stress or some, major emotional trauma or whatever it happened to be. But funny enough, tonight I'm giving a talk for our charity foodforthebrain.org on addiction. And it reminds me of two very interesting things. One is you cannot addict an animal to a drug like heroin or anything if they are optimally nourished. And a lovely saying from Joan Larson, who's really good at getting people off addictive substances, which is, if you scrambled your brains, sitting around in a group and talking about it won't unscramble your brains. So the reason why I'm throwing this one in, because it's not that I think, it's just nutrition. We are, after all, psychological, chemical, physical beings. But very often, in order to be able to deal with emotional traumas and other such things that may be part of the issue, and part of the issue because they lead us to using substances to numb us in some way, eating too much, being a glutton, sugar, alcohol, cigarettes, and drugs like antidepressants and so on, is that when you optimally nourish somebody, their addictions start to fall away, they get more energy, and with that more energy, they've got the ability to break through some of the, deep-rooted emotional traumas. So, it's a little bit like the concept of, if people ask me which is more important, nutrition or exercise, I actually say start with the nutrition, because if you don't get the nutrition right, you're knackered. And if you're knackered, the last thing you want to do is exercise. But once you get the nutrition right, you want to exercise. Once you get nutrition right, you've got some energy to deal with the other psychological issues that may be behind why you're doing what you're doing.
Fantastic. Fantastic. Well explained. Thank you. Janet, have you got any change on that, or do you fundamentally agree? What is chronic disease?
Totally fundamentally agree, obviously, here with Patrick. I suppose I'm coming from it from another angle slightly as well, that the happiness quota. I always ask my patients when I get a new patient in, we do a happiness quota. And obviously, if somebody doesn't feel stable or they've not got support around them, this is what we're trying to do, aren't we, as a PHA, that, they can cycle down into depression and anxiety, and people living on their own. And we've seen this obviously over the COVID situation and lockdowns, and not just elderly people, but, a huge amount of the population has been so affected. And so you just wind down, and then people aren't eating nutritionally because they're, they haven't got the access to good food, for example, and then it just spirals. And so, and the digestive system starts to break down. And like Patrick says, the energy levels start to go, the adrenals start to burn out, and you've got the whole mass of breakdown occurring, so that you get eventually the autoimmune crisis, don't you? And these autoimmune flares, and people are thinking, well, where did that come from? Like you say, Patrick, it takes many years, doesn't it, for a cancer, to develop, and it's been initiated maybe with a shock or a trauma, maybe early on in their life, and then it differentiates out, and then you present with this condition. So, if we can get people in a happier place and to feel they're supported, whether they've got family members or not, we need environmental community support, don't we, to really help people to progress on. So it was just that aspect. I think the happiness quota, feeling at peace, feeling supported is a huge one.
Brilliant. Thank you. Carol, over to you.
Yeah, so, I mean, absolutely agree with everything everybody just said. With the proviso that we have in homeopathy, we have another level, which is, I mean, we would see that chronic disease begins when you're born and it ends when you die. And you go on a track which can be very shallow, or it can be a series of falling off the cliffs, or it can be a very early demise. And there's three things that we see contribute to that. So the first one would be your inherited weaknesses, predispositions, the things you come into this world with, which then primes you for the next lot, which would be your life events, whatever they may be. Coming into the world through a difficult birth, having a grief, having a car accident, experiencing trauma. So that's your life events, which then put another layer on that predisposition. And depending on what your predisposition is, depends on how those things affect you. And also how you deal with those things. So do you do, for example, grief, British stiff upper lip, carry on, it's nothing to do with me? Or do you, deal with it in a healthy way and get counseling or trauma relief or all different kinds of ways of dealing with grief, which enables you to really deal with it rather than just stuff it down and carry on and deal with the consequences of it down the road. And then the third one, of course, is what we would call maintaining causes, which are what we do ourselves, which would be your choices about food, your choices about lifestyle, your choices about whether you go to bed and get any sleep or not, all those decisions that you make that contribute to your disease load. And so to put that in the other way around, I want people to know that they have huge responsibility for their own health. And at the same time, that doesn't mean blame, it means empowerment, that there's an enormous amount that you can do. You can change your maintaining causes, you can deal with your life events well. And of course, as a homeopath, we can deal with inherited weaknesses. So that was what excited me the most about homeopathy when I first came across it 40 odd years ago. If all of this, if all we're doing is done well, then every generation gets healthier. Whereas at the moment, every generation is getting sicker. And where's the end to that? So I just want to throw this in there, that we have a really dismal view of what getting old and what disease means. So I always say that, my view of getting old and dying is that when I decide it's the end, I go for a long walk somewhere I love, say goodbye to whatever loved ones I have still with me at that time, and go to bed and don't wake up. Which all sounded great when I was, 20, 30. Now I'm 72 almost. The road is running out. So I'm taking this a little bit more seriously maybe than I did before. But it's to give people that life doesn't have to mean living on medication, as Patrick said, not being able to exercise because your nutrition is not good. All that. Anyway, so that's it from the homeopathic point of view.
Brilliant. Thank you. And Sarah, your thoughts on what is chronic disease?
A chronic disease is that clinical picture that arises when you are not living life to its full potential in terms of quality and quantity. And I think there are two major pathological threads here that drive chronic disease. The first is poor energy delivery mechanisms, and the second is inflammation. And when we're looking at poor energy delivery mechanisms, the analogy I like to use is the car analogy. And for your car or body to go, you've got to have the right fuel in the tank. And that is all about diet, gut function, and micronutrients. That's the most difficult thing you have to do, but get that right. Secondly, mitochondria. Mitochondria are the engines of our cars. That's what takes fuel from the bloodstream, burns it in the presence of oxygen to create the energy molecule ATP. And life is all about energy. And then the control mechanisms of the mitochondria, which is the thyroid accelerator pedal and the adrenal gearbox. So I always start off by looking at energy delivery mechanisms. And then we look at inflammation. And inflammation occurs when the immune system is busy. And we have to ask, why is the immune system busy? Is it for reasons of allergy, autoimmunity, or chronic infection? So that's my overall strategy to treating chronic disease, almost whatever clinical picture that presents with: fatigue, cancer, heart disease, arthritis, it doesn't matter.
Brilliant. Absolutely brilliant. Thank you so much. Now, what I don't want to do is panic the public. I don't want to get people worried, but I do believe a preventative approach, and you guys can correct me, is probably the way forward, that we start with good habits now. But what are the signs or markers that would indicate someone does need to start focusing on where they're at now to eliminate, moving forward, the chance of chronic disease progressing or coming to the fore? What sort of things should people be aware of? Again, don't want people to panic, but hey, you might be someone who might need to look at this now and give it some attention. Patrick, do you have any kind of standard markers you look for in terms of chronic disease?
Well, yes, and I want to sort of bounce off that excellent description that Sarah gave. So I make 2 points here. Inflammation is pain, redness, swelling. So if you're in any degree of pain, redness, or swelling, something's wrong. Energy, naturally tiredness. So if you're feeling tired all the time, something is wrong. Now, we need to talk about sugar because actually, we now know that all cancer cells, without a single exception, can only run on glucose or glutamine. Let's park glutamine for a minute. So cells, when insulted, switch to a metabolism that only runs on glucose. So sugar cancer, they're like this. And it really annoys me so much that these big cancer charities finally admitted, that obesity is a bigger driver than smoking. So now you can go around and make cupcakes to raise money for their sort of drug and gene research. But then, diabetes, we obviously know is sugar. Heart disease, it always made no sense to me that it was cholesterol that was the problem. We could talk about that. But cholesterol gets damaged. And how does it get damaged? It actually gets damaged by sugar. So if you want to diagnose diabetes, you have a test called your glycosylated hemoglobin, your sugar-damaged red blood cells, and you have glycosylated cholesterol. And that is, in one study, the primary marker or cause, of heart disease. Sugar-damaged things in your body, whether it's cholesterol, red blood cells, whatever. So, and you can measure it. So every doctor knows if they have a patient who they think may have diabetes or pre-diabetes, the first thing they're going to measure is the level of sugar-damaged hemoglobin, HbA1c. So sugar, sugar, sugar. Now, in relation to dementia and cognition, which is my area of speciality at foodforthebrain.org, we generally say there are 3 really important things. 1 is sugar. 2 is omega-3. And we'll talk about that because basically, if you don't have, we are designed to need omega-3 oils, which come from fish. And if you don't eat fish, you've got a real problem. And if you don't supplement omega-3 and you don't eat fish, you've got no way of getting omega-3. Hence, you will have inflammation. Hence, you will have low mood because the brain cannot work without it. Now, for a reason that we may or may not touch on, B vitamins are terribly important too. So I want to just sort of, come back. If you're feeling tired, if you're craving carbohydrates, if you can't stop eating, sweet foods, you've got a problem in relation to glucose metabolism, and it is going to lead to chronic diseases. So it's kind of the elephant in the room. It's the very first thing you've got to deal with. There are different ways of dealing with it, ranging all the way, and I'm sure Sarah would, bounce off that into ketogenic diets. We have no carbohydrates. I've mentioned many times what we call a low glycemic load diet or a low GL diet, where you start to eat less carbs. But basically, you've got to deal with the issue of sugar addiction, carbohydrates, if you're going to reverse the process from any chronic disease.
I'm going to throw it open now if anyone wants to jump in. If there's any markers outside of what Patrick, and what we'll do in a minute is we're going to come on to how our lifestyles, how we can change that to prevent the onset of chronic disease, which is sort of touched on. But any of you ladies have any other markers that you look for, keep an eye out for, that would suggest chronic disease issues or incoming problems?
I think we've said it.
We've said it, right, fine, fantastic.
I can only say that from our point of view, we don't have specific markers like that per se, because we usually get what we call the teeth patients, which are they've tried everything else, now try homeopathy. So usually by the time they get to us, they're in a pretty bad way and they've got loads of symptoms and no one's in any doubt where the problems are, unfortunately. But yeah. Sugar, again, Patrick, 100%. And people now associate sugar with energy. So they have to have sugar, because if they don't, they won't have any energy. And there's so much of it hidden. I went through this with my sister when she had her cancer. The amount of education she needed to figure out all that hidden sugar in all those foods. It's a nightmare for people. They need guidance, which presumably, Patrick, you do on your website already. So yeah, 100%.
Absolutely. No, fantastic. Thank you so much. So in just a couple of minutes, someone's watching this video and they're thinking, all right, I consume a lot of sugar and I don't do enough exercise and I'm always tired. But maybe that's as far as it's gone. That's where they're at. So nothing's been noted, nothing's been addressed yet by a doctor or practitioner. However, in a couple of minutes, I know it's a short period of time, Patrick, we'll start with you and then we'll move in with the ladies. What can people start addressing? Obviously, sugar and diet is the main thing, but in a bit more detail, what can they start doing and addressing to help themselves to start reducing potential issues incoming in terms of chronic disease? What can they do now on the daily to start looking at this and doing what they can to prevent anything escalating further?
Well, this sounds commercial, but it's not really meant like that. My best-selling book at the moment is called Low GL Diet Cookbook. And GL means glycemic load. And if you get that book, it's got a whole lot of really easy breakfasts, really easy lunches, really easy dinners. It tells, and you can pick any one. It also explains the rules, because in essence, you've got to get to the point where half of what's on your plate is living vegetables, maybe some fruits, berries, and so on. But, you know, if it's lunchtime, half of your plate needs to be effectively something you could have pulled out of the garden, whether it's cooked or raw, ideally organic. And 1/4 is protein. So that would be the amount of fish or meat that would fit into the palm of your hand. If you're vegetarian, slightly larger portion of beans or lentils or something else, tofu perhaps. And 1/4 is carbs. And carbs, we mean rice, potato, pasta, that sort of thing. Actually, much less carbs. There is an approach which goes even further, where you kind of eliminate the carbs completely. But, even that is a big step for a lot of people. So rather than sort of teaching the rules, but that's not a bad rule, half of your plate needs to be, vegetables, for example. The book's very good because you can just do it. And what happens, by the way, is that within about 3 days, it takes only about 3 days, certainly within a week, your energy just goes shooting up. And the reason why you have to commit to these things for at least 3 days is as you start to reduce your sugar load, which is an addiction, you can feel worse, but by the end of the week, you will feel better. So that's kind of, rather than me explaining everything to do, just, get the book. The recipes are great. Get on, do it.
Sarah, what about yourself? What would you say is a great one in terms of lifestyle changes or diet changes that people can adopt now that's not too complex? Like Patrick said, start with this and then you can go from there. What else would you consider to be an important step?
Well, making lifestyle changes is always difficult, and it's particularly difficult with sugars and carbohydrates because they're addictive. And so the first thing you have to do is to recognize that you are eating an addictive food, and that might be processed food, which of course is going to be high carbohydrate, sweet food, too much fruit juice or whatever. So as soon as people recognize that the addictive nature of eating sugars and carbohydrates, that gives them the intellectual imperative to make the changes. And get the book and just do it.
Fantastic. Love it. Carol, what about yourself?
Yes, again, to all that, I'm just going to be the supporting actor in this. I think keep saying yes, exactly what these guys are saying. But there's a couple of things I would say that people don't ordinarily know about, that the processed food industry spends hundreds of millions of pounds, dollars, whichever, on exploring what they call the bliss point in any food, in any processed food. So that means the point at which you're most likely to get addicted, the one that gives you the dopamine hit, and then you're going to go back for more and more McDonald's or whatever. They spend millions and years refining this so-called food so that all you want to do is eat it. It's shocking, it's tragic. And so I'm imploring people to look at their diet, as you guys are saying, as we would say as homeopaths. And I would also add on, yes, I'm very much a Nike, just do it. And also even if all you can manage is a few small changes, they build on each other, and you start to feel the benefits of small changes, and then you get that circle, if you like, of going down into chronic disease, starting to turn the other way and create your health. So I don't want people to think that they have to do everything all tonight and live a different life tomorrow. You know, you can do it a bit more. I don't know.
Yeah. I must admit, when anything I've had to face, I have to break it down into what I call bite-sized chunks. If I try and do everything all at once, I fail because it's too much. If I just set myself smaller targets bit by bit, it seems that much more manageable as a kind of, you know, regular person with no health qualifications. That's, sorry, Sarah, jump in.
That's all very well, but sometimes that doesn't work for addiction. So if I told one of my patients who was smoking, say, oh, it's okay to have 2 cigarettes a day, we all know that's bad advice. They just get back on the addictive cigarettes again. Ditto alcohol. You know, alcoholics celebrate complete abstinence because they know one nif drop switches on the craving. And it's the same with sugar. It's just as addictive, arguably more so. And so you really do have to cut out the sugar ruthlessly. Okay, bring in complex carbohydrates, starches, you know, whatever. But the sugar is the addictive element. And my view is it's difficult to cut it down. And as soon as you get rid of it, the craving starts to go away.
Fantastic. Lovely. No, thank you.
Sorry, I just want to clarify to Sarah. I wasn't saying that you should only have 10 spoonfuls of sugar today instead of 12. I was meaning overall, pick sugar and hit that one and get it sorted without thinking you have to completely change everything that's in your life. You know, people think it's all or nothing. Yes, an addiction is all or nothing. Agreed. Yeah, so
hit the sugar first before you start facing the 5-mile runs and so forth. Yeah, okay, no, absolutely.
I'd like to
and
say
Janet,
else.
Sorry, Patrick, jump in.
Sorry. Well, yeah, no, it's just I'm under a lot of stresses at the moment, various things, but I won't go into it. But the point is, I think many people are. And their default is, oh, I'm really stressed. I'll drink some alcohol. I'm really tired. I'll have another coffee. I'll have something sweet and so on. So I decided this morning I'm going to get up. I've inherited a farm and go weeding.
Wow.
So anyway, I decided my first half hour, actually it turned into an hour and a half. My first half hour is outdoors. There's something very interesting about this, and Professor Robert Lustig said it, that basically the neurotransmitters, the chemicals in our brain, are either excitatory, they excite things, and when you were talking about the food industry, they've learned how to trigger your dopamine, which is your feel-good thing, which we call pleasure. So you have the happy meal, the happy hour, you know, everything is oriented towards what's that thing that will make me happy because I'm feeling really low. But actually, because adrenaline and dopamine are all excitatory, what happens is the more you have, the less reward you get. Your neurotransmitter receptors shut down. So you need more and more and more and more and more. So when you're feeling miserable, you seek pleasure. Now, happiness actually comes from serotonin. And serotonin is inhibitory. In other words, it doesn't send a further message. You can't get addicted to happiness in this way. So then the question is, what promotes serotonin? And the answer is exercise does it. You know, sunlight does it, connecting with nature does it, and so on. So and I'm using this very practical example, get up in the morning, get outside, half an hour, have a walk. If you've got a garden, do something in the garden. Then, and we're talking here about hunting and then gathering, or hunting and then eating. What do animals do? They do the exercise and then they eat. Then have a good breakfast. So those like first 2 steps, start your day well, before you consider which addictive substance is going to hijack your life. And if you do those 2 things, you just buy, you know, enough time, enough space to then make sensible decisions.
Yeah,
Fantastic. No, wonderful. I do like that. I go out and I let the chickens out in the morning and I go for my little, what I call my morning prayer walk, and I come back and I feel actually calm, because I've got a tendency to get a little bit anxious because I get so busy. And actually, I found that's the best way to start my day, is to go outside, be away from it all, leave the screens at home, a little bit of time in nature with my animals, and then back into it. And I come back also in a very calm state as well, which I think is important as well. So no, fantastic. Thank you for that. One thing that I want to just touch on is we know the NHS doesn't always approach things in the right way, and a lot of people are still very much going to the NHS if they've got concerns and issues. And what I'd like to know from you guys is, how could the NHS adapt their current treatments or approaches to chronic disease more successfully outside of the preventative approach for those that have then got some sort of chronic disease? How could the NHS take a more natural or holistic or whatever approach you think that would be better than what they currently do? Because from what I can see, it's quite invasive. It's very much tablet form or therapy form that is invasive. Jump in, Sarah, jump in.
What you're asking for is near impossible, because all the therapists and the NHS have to be re-educated, and they are currently being educated by Big Pharma. And it's not education, it's brainwashing. And until you cut the strings between Big Pharma and the health service, it will never improve.
100%. I was leading down that point, Sarah, but you were straight in there. So fantastic. Fantastic. You were in charge of the NHS. Okay, people are still going to the NHS and they think that these are the only ways forward. Patrick, what would you do?
Well, I want to give you two stories here, and they're kind of interesting stories anyway. It's 1980, and I meet the first nutritional medicine doctor, Dr. Stephen Davies. And he says nutritional medicine is evidence-based medicine, is what doctors should be doing, and set up all sorts of journals and this and that, whatever. And Geoffrey Cannon, who was a leading journalist and activist, he wrote, Dieting Makes You Fat, Superbugs, The Food Scandal, and so on. He said nothing's going to change until we change the system. And he went off and did that. And I said, do you know, I don't think you can really study nutritional medicine within a GP training. I mean, it's just too long and they've got so little time. I think we've got to make a new profession, which I called nutritional therapy, so that doctors could work with nutritional therapists. So anyway, we met a few years later and Geoffrey Cannon said, I give up, can't change the system. It's run by, big food, big pharma and all the rest of it. And Stephen Davies' wonderful initiatives kind of petered away, but they made the ground for other things. And then literally last weekend, I'm at the Integrated and Personalized Medicine Conference. There's 1,800 people signed up. And the two biggest groups of people are GPs and nutritional therapists, of which we've got thousands. And that's the whole point. They don't always talk to each other. They're like silos, but they do exist and they could work together. So I'm not going to sort of totally give up, because actually out of that, we've now got about 50 GP practices who are kind of interested. But I think step one is who is your doctor working with, that can do nutritional medicine and so on. I think that's really important. And as Sarah says, what may need to happen is that the GP needs to get educated by coming to one of these kind of conferences. But who are they working with? I think there is the possibility. Years ago, we didn't have those two groups. Now we've got, those two groups. So the question is, how do we put the nutritional therapists together with the GPs? Because then there would be an opportunity for change.
It's something we really encourage within PHA, and a lot of our practitioners in different areas are doing it, is this referral to somebody who, if you like, I hate to use the word specialist and so forth, how it's been abused over the years, but somebody who is more specialist in that area and guide the patient towards that. So if they see something that is clearly a gut health issue or so forth, they go to a nutritionist. And I think it would be lovely to see that come into play, but I'm not holding my breath on it. Janet, from your point of view, how do you think that the allopathic approach could alter or change in order to deal with chronic disease? Because I think a lot of the, if you like, more holistic naturopathic practitioners, they've got it pinned down, but with some of the allopathic guys, we know it's not there. What would you suggest we need to start pushing the NHS to do? And although I'm with Sarah, I think slight boulder up a hill, but push the NHS to do more in terms of dealing with chronic disease.
Yes, I'm definitely with Sarah, of course, and what Patrick said. I wonder, if we can get more health coaches educated. I know there's a lot going through the system now. There's a lot at Manchester CNM or London CNM, wherever they're training, and they, you know, they've been trained really well. And if we can get those attached, maybe, I don't know, to GP practices, to try and direct in from that angle, and get the GPs understanding that we have got to cover the basics for starters. And we are talking about preventative medicine. And if we get all those in place, linking with which we don't think we've mentioned so far, the dentistry side, because obviously that's a huge area that if we don't have a healthy mouth, and we've got a lot of amalgams, amalgam fillings and root canal fillings that, you know, are causing systemic problems. So it's really, I think, opening the eyes up to, you know, getting these health coaches, get more health coaches really across the entire UK, and working alongside we in practice, whether we're homeopaths or naturopaths or nutritionists or whatever we're doing, you know, and getting the whole system understanding that we have got to get those basics in place. And obviously there's the Wi-Fi situation, the 5G, like we mentioned before, and geopathic stress. There's, you know, so many areas that we could really be looking at and getting all the basics done. And then we use the hospitals for the A&E and the brilliant work that is done in A&E, you know, because we couldn't do without them there, of course. So I don't know if that covers the...
No, absolutely. And thank you for bringing that up. I just want to put it out there, if there are any allopathic doctors or nurses who are currently within the NHS and you're liking what you're hearing, go and have a look at our website, because we are connected up with CNM and other organisations to help you train and diversify your focus into more naturopathic or holistic practices. And we've got discounts and so forth, because we want to encourage lots and lots of doctors and nurses who want to leave the NHS or aren't happy with what they've seen in the last few years and realise there are other approaches out there, to investigate that and find what, you know, resonates with them and what else they could train in should they wish to. So that's fantastic, guys. This has been fantastic. And I think one of the jump in, Carol, please. Can
I just jump in with the NHS bit? Only
yeah, sure, please do.
We have a kind of slightly different skew on it, maybe. Obviously, I agree with you. The NHS now, to me anyway, is nothing more than a retainer for big pharma, who are allowed to put their prices up by the day with no regulation whatsoever. So they've been co-opted, captured, whatever words you use. So that is what the system is here. It hasn't always been like that. And I think now, given the debacle that has been COVID, this is a perfect opportunity for change, because the general public have lost a lot of faith in what would they call conventional medicine, allopathic medicine. They know that it doesn't always work, that many doctors betrayed them in various ways. I don't know how much I'm allowed to say on here, so I'll leave it at that.
We're for free speech. We're all for free speech, Carol.
So there's an opportunity there in terms of the public want something different. So that's one thing. Two is that they should immediately employ people like us, no question about it. And that homeopaths, of course, we are ultimately primary care medicine. So in the right circumstance, I've worked in hospitals where homeopathy is the primary care medicine. It's got all the bells and whistles of all the, you know, the drips and the this and that when needed, and all the A&E stuff, which is spectacular to save your life. I get that. They saved my life at one point, but they don't know how to create health, and they don't really know how to deal with chronic disease. So put the homeopaths in the middle, primary care medicine, have everybody else in there as well, do loads of prevention so nobody ends up in, hardly anybody ever ends up in hospital in the first place, and off you go. We will have a generation that is healthier than the present one, and on it goes. So that is my vision. It's been my vision for 40 odd years. I feel like we're closer now than we've ever been. I am a pathological optimist. Okay, I accept that. But I do feel it's a possibility.
This is where PHA comes in, because obviously, you know, this is the vision we want to create, where we have both more holistic naturopathic approaches, and there is space for the allopathic. I personally believe that, as particularly in an acute situation. But yes, throughout PHA.
Don't forget homeopaths, because we do get
No. I'm looking forward to that first aid information, Carol, because it still blows my mind how much homeopaths can do at sort of that secondary acute level as well. It's
primary care
incredible.
medicine. That's all I'm going to say.
Yeah, absolutely. And obviously there's people like Patrick who've got some wonderful, if you like, initiatives
we all
going on
in there. We all should be in there.
Yeah. And this is what we want to do with PHA, because if I'm with Sarah, I don't think the NHS is going to change, certainly not for a long time yet. You know, and there needs to be something else, and that's where PHA is trying to come in and make sure that there are some supports in place, there are some safety nets in place, and hopefully over the next couple of years we'll get that right and it'll be even more prolific. And just Patrick, if you could just give 2-minute overview of what we spoke about earlier in terms of what you've got coming, because I think these guys would love to hear about it, or what you're working on with your test. These guys would like to hear about it, and it's a pre-lib to go out for what we've got coming in August, so people can learn a lot more, which is predominantly for practitioners.
Yeah, I mean, we're running a campaign called Alzheimer's is Preventable, but just sort of stick with this for a minute, because the same is true with arthritis and diabetes and heart disease and feeling tired all the time and so on. But it just so happens that foodforthebrain.org, anyone, no cost, can go in, do a proper validated cognitive function test. It takes about 15 minutes, then fill out a questionnaire, which then works out your future risk based on 8 domains. And those 8 domains, we're talking here about sugar, brain fats, omega-3, vitamin D is in there, antioxidants, polyphenols, fruits, veg are in there, healthy gut is in there, active mind is in there, active body, sleep and calm, which is stress, and so on. You actually see what's driving your future risk. And that's going to be those 8 factors, a very nice way of organizing what's driving your future risk of cancer, heart disease, diabetes, arthritis, etc. And what we're really talking here is about making the invisible visible. So it's a very slick little thing that's going to take you 20 minutes, and then you'll see what you score, and you'll see what's driving things. Because as I'm listening to everything people are saying, there's kind of 2 issues. One is there has to be a wake up. So for someone to take action, there has to be a wake up. Often that wake up happens after a lot of pain. You know, you just go and finding no solutions, but there has to be a wake up. This questionnaire kind of helps that wake up to happen. Maybe reading a book does, you know, and so on. So that's that. And then we start to realize in reality, we have to enter the parallel universe of how you get to help yourself. And the bottom line is it costs money. Apparently the NHS doesn't, even though it's spending a quarter of all our taxes. So there's that issue of just making the leap where I'm driving the things I've got to do something about it. I'm going to have to spend some money. Now, I'm not necessarily suggesting this as a thing, but wouldn't it be cool if you could go in and on the web, it's all, how much does your addiction cost? And you just add up, how much am I spending on alcohol, sugary snacks, cigarettes, or anything else that actually is taking money out of my health deposit account? And you'll probably go, it's a few quid a day. Right, there's your budget. You know, there's your budget to go and see this practitioner or read that book or do this course or something else. So those are my thoughts. But foodforthebrain.org's free test. It's going to get you thinking, you know, in the right way. And by the way, prevent Alzheimer's, only 1% of which is caused by genes. And we think Fiona Phillips, probably her family has one of those rare genes that actually, you know, does drive it. But that's less than 1%.
Brilliant. And we'll have more on that coming out via PHA next month. We think this is fantastic, and happy to throw some weight behind this and get that out there, so people can take that more preventative approach. Guys and girls, thank you so much for your time today. We'll get this out shortly. This has been a really good start to, I hope, trigger some thoughts for people in how they approach their health and what they can do to take some preventative action moving forward. And those that do find themselves in that position can reach out to a practitioner and get some guidance on their journey to healing. So thank you so much for your time today, everyone. We'll send a copy to you, and let's get together soon, and we'll look at other topics we've got coming up. But thank you.
Thank you. Good to meet everyone.
Yes, to meet you all.
Yeah.
Bye-bye.